Hi guys, this is Dr. C with Healing Arts Physical Therapy, and today I want to tell you about a muscle called the piriformis. And I got to tell you, it's a real pain in the butt. You do not want to get this condition. If a person presents to me and they're having butt pain, back pain, pain that radiates down their leg, oftentimes called sciatica, I often look to see if they have a tight piriformis muscle. And the significance of that muscle is it lies right over the sciatic nerve, and if it gets tight, it can cause pressure on the sciatic nerve, leading to nerve pain down the leg. The piriformis syndrome usually doesn't come in isolation. People will have back problems as well as hip problems, issues in their sacroiliac joint in combination with the piriformis syndrome. But there's some times where they just have piriformis syndrome alone, and just doing a few sessions of hands-on techniques to release that muscle can be very effective. I've had patients where they come in, they have that condition, and it's just 1 or 2 sessions, they feel 100% and they can get back to what they want to do. So the piriformis, it's quickly relieved, but I need to teach people how to move correctly, how to stand correctly, walk correctly, and so forth, because if I don't do that, then that muscle will tighten up again. So I often see people that tend to favor one leg, they put more pressure to one side when they sit or stand, and oftentimes these people are very tight in the hip joint. So if the hip doesn't rotate in or out, it can cause a lot of immobility to the hip, and therefore the muscles around the hip, especially that piriformis, becomes tight, and then it compresses the sciatic nerve, leading to that sciatica pain that you have probably heard about. And so sciatica is multifactorial. There could be many factors that can lead to that sciatic nerve getting pressure placed on it. So it's up to me to find out where that where the sciatic nerve is getting that pressure. So I want to show you guys next in on this anatomy chart behind me what the piriformis looks like and the significance of it. And then after that, we'll go into exercises that I often prescribe people with that condition so they can work on hip mobility, stretching that muscle, and being able to self-manage. So on the anatomy chart here, on the left-hand side, you can see the glute maximus muscle here. And then over here, the muscle is taken away and it exposes all these deeper muscles in the butt region. Number 27 there is called the piriformis. And you can see this little spot here called the sciatic notch. And that's where the sciatic nerve comes out of the pelvic region and lower back region. So up here, the sciatic nerve has many nerve roots that come out of the spine into the sacrum, and then they converge and go through that little notch there, and then down the leg. So if that piriformis is tight or inflamed, it can lessen that space and cause pressure on the sciatic nerve that goes right through there and underneath that muscle. So we want to do techniques to get that muscle stretched out, and also education on how to prevent overusing it throughout the day. So I want to show you guys some neat, handy exercise that you guys can do yourself at home to prevent this condition. However, if it doesn't get better and you feel like you're still having pain in the butt and sciatic pain going down the leg, then please, by all means, come and see me and I will get you fixed. So the first thing I would do when treating this piriformis syndrome is to roll out the muscle first. Smooth it out, get it flexible, release the fibers of the muscle, so afterwards you can successfully stretch it. So there's a couple ways you can do it. You can either use a foam roller or a massage ball, and replace this massage ball. You could even use like a tennis ball, something simple like that at home. So I'm going to do first with the foam roller. So I can roll down to my hamstring, and then I can go up higher, targeting the glute muscle, deep into that piriformis. I can kind of roll onto my side a little bit, while I do that as well, just really target into that muscle, find where it's sore, and just hang out there for a little while. You want to go from it being tender to being less tender and start to feel just like normal pressure, from a feeling of it being tight to feeling of it being more relaxed and soft under the thing that you're rolling it with. Then another thing is using a massage ball. So you can use that underneath as well. Just kind of find that muscle and just start rolling it along. Just more refined movements is actually better. Don't try to go off the muscle. Try to stay right on the muscle with the ball and just roll it for a few minutes. So after we have released the muscle with some massage techniques, then we want to stretch the heck out of it. So the first thing to do, I'm going to grab this stretch strap here, wrap it around my foot, and I'm going to lay on my back. Okay, and then I'm going to pull my leg up like this, trying to keep my knee straight, and then bring it across my body. And what that's going to do, it's going to stretch right into that butt muscle, and it's going to stretch the sciatic nerve that goes right underneath that piriformis muscle. So that sciatic nerve has been tight because the muscle has been compressing on it, and it doesn't know how to stretch through the tissue and the leg very well. So you want to start targeting stretching it out, getting it lengthened through the leg, so when you move, you walk, you take large steps, you stretch out, you get in certain positions. If that nerve isn't able to stretch and glide through the leg, then it's going to be very uncomfortable. So there's that. Then what we can do with the same stretch strap, we can put it behind the thigh and then bring the leg with the knee bent up and over. So you're trying to cross that knee towards the opposite shoulder. Get angled a little differently. There you go, up and over. So it's not straight up, it's up and over. Then you can also put your knee or your foot on the opposite knee and then pull the leg up and over like this. Another thing you can do is put the stretch strap around the thigh that has the knee on it and pull the thigh up. Now you can do this without the stretch strap too. You can just use your hands. But for a lot of people, it's pretty tough. So they just don't have that flexibility to reach, especially the older folk population. So I always encourage using a stretch strap. And then these stretches should be held for at least 30 seconds in length. 30 seconds has been found in research to be kind of the key number to cause change in the muscle fibers and allow it to stretch out and create what's called a creep response, where the muscle stretches out and it stays stretched out. Otherwise, you hold it for a few seconds, it just stretches out, and then it goes back to its normal length. So we want to stretch it out and keep it elongated, so that that piriformis is not tight anymore, and it's not pressing on the sciatic nerve underneath it. And then I would also try to do what's called a pigeon stretch. So the pigeon stretch is a more advanced stretch to the glute and the piriformis. I can show you some modifications there if it's too tough. So what you do here is you try to put the leg underneath you like this, with the hip rotated out and the foot going to the inside here. And then what you do is you want to try to lean forward like this at the hip. Try to just basically lay on top of that leg. Okay, and then hold that for about 30 seconds. That's an uncomfortable one, but dang it, it works. And then you can see it from the side here. You go like that, and then you lean forward. And then hold it for 30 seconds. So a modification could be what's called the Playboy stretch. So basically you're trying to pose like a Playboy model. You probably have done this one in PE class as a kid. But you grab your the side of the knee with the opposite arm. You just kind of try to pull that knee up and over, and then you rotate towards that leg that you're stretching. So you can do it that way. Another way, you could just kind of come like this here, and then work on, you go into a kind of a lunge kneel stance here on the side, and then you grab the side of the knee, and you pull the leg over. Hi. And then you just lean into that leg and hold it for 30 seconds. So these are great stretches to target the piriformis muscle, get that hip loosened up, and then the pain should go away during daily activities. But if you continue to have this pain, then please consult me at Healing Arts Physical Therapy, and I'll be happy to help you get through that hump and get back to feeling better. You can also find these videos on my YouTube channel, which is found at Healing Arts Physical Therapy. All right, guys, hope that helps.